edition that will be equally successful. I want to say a big thank you to all the teams that competed in this championship. Even if you didn't make it to the finals, you have exhibited a rare showcase of talent and excellence. Because as I always say, not everybody has what it takes to debate nor speak to a large audience. So congratulations to every one of you. You are all champions. As we look to the future, we are excited to build our achievements, to welcome new members, and to continue making a positive impact to our community. In conclusion, our debating society progress over the years is a testament to the power of teamwork, determination, and a shared passion for debate and public speaking. I am honored to be a part of this community, and I look forward to seeing what the future holds for us. Ladies and gentlemen, the Vice Chancellor, principal officials, we thank you for your dedication and endless support that you have shown towards the society over the last 10 years. I mean, if there was no University of Medical Sciences Ondo, first of its kind thriving, there would be no such thing as the Unimed Debating Society. We are proud products of this great institution, and we thank you all for making this a possibility. Our esteemed guests, chair adjudicators, and great Unimed students, thank you all for coming. So now we can sit back and enjoy a round of debating excellence. Thank you very much. Let's give it to ourselves. So without wasting time, we'll move to the debate finals. I'd like to have the opening bench to this side. The opening bench to this side. Then the closing bench to this side. The closing bench to this side, please go first. The chair for this session is Ms. Adetotin, and co-chairing with her is Dr. John. Please let's put your hands together for them. And Dr. Godswill, and myself, and other adjudicators from the faculties that made it to the finals, and every other one that has adjudicated during the preliminaries and the semi-finals. The motion actually has an info slide, and the info slide reads, recently, a medical student from Unimed raised concerns on social media about the gender inequality in obstetrics and gynecology, specifically regarding the involvement of male medical students and doctors in examining and attending to patients, female patients. This sparked an online debate surrounding patient rights and the perceived privilege of male professionals in this field. That's the motion slide. And the motion reads, this House regrets the rise of male obstetricians and gynecologists. Debaters, in line with the standard, you speak for 7 minutes. Over to you, Chair. So we're starting today's round by calling on the Prime Minister, Oluwatobi Olowore, to come and present the case of the OG. Here, here.
Femi, and as the Prime Minister of the opening government, I want to state that this House regrets the rise of male obstetricians and gynecologists in the medical sector. Now, first of all, for those who don't know, an obstetrician is a specialist who treats female diseases and female pregnancies, handles female pregnancies, and then a gynecologist is a professional who treats female diseases. Now, first of all, we've all know, I've had this conversation with my mates before, where we joke about getting treated by a male nurse who goes to the clinic to get an injection. And I feel like it's the same experience that females have when they get to the clinic or they get to a hospital and it's a man that's there. It's a very, especially for females that are very young and it's their first time experiencing things like menstruation, and they want to get drugs, they want to figure out what's wrong with them, they want to figure out how it works. You know, they get to the hospital and they have to meet a man there. They are not confident with opening up, they are not confident with speaking to these people about what's going on with them. And I've noticed that a lot of children actually hide what is wrong with them, whether they are okay, whether they are not okay. They hide it from their doctors because they don't want to meet a male professional. Now, another thing that we need to discuss is the cases of gynecologists who sexually abuse their patients who come to them for treatment. It is a very disgusting practice, but it exists. Some gynecologists take advantage of people who are in their care, and they can't know, sometimes they are under the use of anesthetics and they are not aware of their surroundings and they are taking advantage of, which is very wrong. Something else we need to discuss as well is the female viewpoint on obstetrics and gynecology is heavily ignored. Now, if we have a lot of male doctors, majority male doctors, who do not feel the pain that women feel, they've read about it, it is abstract knowledge to them, but they don't experience it, they don't feel what the females feel, which is something that is a whole other world. I remember someone asking me, why do I have to go through once? And she said she knows the biology of how it works. But when you need something to get fixed, if you're a woman, you will handle it differently because you are experiencing it. You are not just reading about it. You don't just go to school to study it. Another thing we need to discuss is they are taking the space of a lot of passionate females. They are taking up a lot of roles where a lot of females would do better in, midwifery, things that a lot of gynecologists handle. Meanwhile, if they were females, they would do a great job at that. Then we need to think about the fact that it is not proper for any field to be oversaturated, especially a field where all the patients are female. Now, what do I mean by that? When you walk into a gynecology clinic or something of the likes, you meet every single female you meet there is a female. Meanwhile, every doctor you meet there is a male. And that is very wrongly skewed towards the wrong direction. At least there should be a sort of equality on that path. And there's no way that there are not enough women that are interested in the path. The fact is that a lot of the specialty is oversaturated with men. Something else we need to discuss is that is why and how why the specialty is oversaturated with men, and how would females fare better at it? I feel like it's a question that begs for an answer. And the reason why females should do better at it is because females are more drawn towards things that they do, towards things that affect them, things like fibroid, things like pregnancies, ectopic, eclampsia during pregnancy, pre-eclampsia. A woman who has had a miscarriage would definitely be more passionate and more enthusiastic towards things like that than a man who has not even experienced, a man who can never experience a pregnancy and only reads it in his medical our textbooks. We need to discuss the fact that a lot of research, there's a lot of research that has not been done into gynecology and obstetrics, into female care, because men don't know what is missing. They don't know what women need. They don't know what women are lacking. They don't know what women have been lacking for years. Men take a very practical and straight to the point approach. There are women who are embracing and enduring what they are going through. They take a more holistic approach because they know how it is from their own perspective. And we are missing all of that. It's a whole world that we do not experience, we do not appreciate, because women, and there are not enough women in that field. A lot of men might bring up the case of competence into this discussion, but then again, are you going to say that women are not competent caregivers? Are you going to say that there's not a lot of clarity in fields that women go into, women who are researchers, women who are clinicians, and women who are educators? So on this ground, I'd like to also reiterate my point that this house regrets the rise of male obstetricians and gynecologists, and having an oversaturated specialty is not proper, especially a specialty that has an all-female service. As a result of that, women don't get the care that they're supposed to get. They don't get fulfilled. Their care does not reach its limits. Thank you very much.
Thank you very much, Prime Minister, for that wonderful speech. Now we welcome the leader of opposition to present the case of OO. Adelabu Moyolua. Esteemed members of the House, my Prime Minister failed to give us the context to today's debate. Now, this debate is taking place in a country where the health system, the ORG specialty, the obstetrics and gynecology specialty, is actually saturated by male doctors, and the fact that this healthcare system is actually a better place. My Prime Minister also talked about sexual abuse. Sexual abuse is not, there's no direct correlation between the male obstetricians and gynecology with sexual abuse. Sexual abuse is just like, it's just something that is extreme, and it happens everywhere. Even pediatric patients get abused. We don't go around to actually stop male doctors from treating them because of sexual abuse. Then my Prime Minister talked about the female bill being heavily ignored, that they don't feel what the patients feel. As a doctor, you have been trained to be empathetic. You don't have to feel what your patients feel before you can treat them. I'm not a sickle cell patient, but I can be trained to treat a sickle cell patient. I don't feel their crisis. I don't know what is. I cannot feel it. But then I'm being trained to be empathetic, that even when I don't feel it, I can still train them. So today, because the rise of male obstetricians and gynecology has done more good to us than harm, because it's not causing any harm to a vulnerable group, and because it does not have any long-term consequences, we have no regret to have allowed the rise of male obstetricians and gynecology. And today I'm going to review the motion with 5 points. The first is equal opportunities. What do you mean that because I'm a male, because I'm a guy, I don't get enough platform to actually pursue my passion? It's not about the fact that they are taking space of passionate females. If they're taking space of passionate females, why do you feel like stopping them? What if that's their own passion? So what you're trying to do is that you're actually not giving them enough platform. We have so many opportunities. You're not allowing them to explore the available opportunities because of their gender, which is not fair, and that would have done more harm to us than good. Also, the rise of male obstetricians and gynecology has actually helped with the maintenance of standards. Now, when you segregate a group of people, like, oh, these are the only people that can go into these professions, now you're actually limiting the efforts to actually maintain the standard. Now you're supporting mediocrity. And then you said about, still on the point about that, the female view is being heavily ignored.
You said that adding more females into the sector of obstetrics and gynecology is going to influence mediocrity. Are you saying that female professionals are mediocre?
Thank you very much. I'm not saying female professionals are mediocre, but I'm saying that when you're separating a number of people, and like it's only this number of people that can actually go into this field, you're actually reducing the standard. Because what of people that have better ideas, you are depriving them of the ability to actually bring their own ideas to the table. And then, still on the maintenance of standard, the streamlined decision making. Of course, the man does not have the same genitals, he doesn't know what it's like to go into labor. But then sometimes you need some decisions that needs to be vetted by a decision outside the box. So if you've limited this gender because you've closed the door against them, you're going to just keep building on streamlined decision making. Also, the deprivement of rights. Everybody has the right to choose what they want to do with their lives. You can't, because of someone's gender, actually push them aside. That would be so unfair. And at the end of the day, you are just grooming angry doctors, people that have to go into another sectors because they could not get what they want, which is not fair. Also, you don't have enough justification for it. I try to think of it. It's not helping our social, it's not helping the social rights, it's not helping the economic rights. In fact, it's even doing more harm to our economy. And then it's high time we stop indulging without justification. You can't just come and because of some concerns that are not even solid and say that because of that you don't want these people to actually go into this sector. It's actually not allowed and it's not going to be fair because you don't have enough justification for this. Also, lastly, you're not addressing the root cause. You talk about sexual abuse. You talk about sexual abuse and some other things. The rise of male obstetricians and gynecology. So, I'm restating the fact that the healthcare system is actually a better place because we've allowed the male obstetricians and gynecology. Do you know what the society would have looked at if this was absent? We would have been living in a society that people are being deprived of their rights because of their gender, where the standard is being lowered because of segregation, where opportunities cannot be explored by everybody. There are different of exploration of opportunities, and also a country where you don't address the root cause of this thing and you just take drastic measures to actually curb it. Way forward is you give people the right to choose. You give patients the right to choose who they want to treat them, and then the concept of chaperone has also aimed. And then the fact that these doctors actually take consent. They don't impose themselves on it. Despite the fact that they are the one in charge, they still don't impose themselves on it. So because of this, we've come to the conclusion that because the rise of male obstetricians and gynecology has not done any harm to us, we don't have any regrets about it. Thank you. Thank you very much, Leader of Opposition, for that wonderful speech. Now we welcome the Deputy Prime Minister to come and conclude the case of the OG. Here, here. Oluwatobi Olawoye.
I would like to state the motion. It states that this House regrets the rise of male obstetricians and gynecologists. I'd like to state and heavily emphasize that this is a regret motion, not a policy motion, something my opposition speaker has failed to take into account. First of all, she said that equal opportunities should give men the right to pursue their passions. This is a regret motion. I'm not saying men should not pursue their passions. I'm saying that because of the harms that men have caused in this obstetrics and gynecologist field, because of the harms they have caused, we regret their rise. And my opposition also said that doctors are trained to be empathetic and that men are empathetic too, so they can sympathize empathize to women's needs. This is wrong as well. Obviously, if empathy is taught by experience, for example, a woman who has gone through, let's say, miscarriage, is more able to empathize with another woman going through the same thing. She's more able to provide care. She's more able to provide support, emotional support. So when we say that doctors are taught to be empathetic in medical school, and because they are taught to be empathetic, they can provide the same empathy to their patients, that is obviously false. Empathy comes with experience. And because women have the same experience, such as they provide, for example, a female O&G specialist has more, she cycles, she becomes pregnant. A female O&G can have a polycystic kidney. So women obviously they can feel the pains of their patients more, and as a result, they can be able to sympathize with their patients and provide more care. So the point that my opposition speaker raised is totally false. I'd also like to talk about the points raised by opposition that if we limit say that only females can practice in this field, we are saying that we are limiting the competence in the field. I'd like to say that I'd like to restate, this is a regret motion, not a policy motion. We're not limiting any gender. Our stance is simply that due to the harms that males have caused in this field, we regret their rise. Now, I would like to go to my points. First of all, I would like to talk about research in the educational aspects. We all know it is a common thing that women syndromes or women diseases are under-researched in the world. Women have the least researched areas or least researched things in the world. And we think that a cause of this, or a likely cause of this, is because a lot of males are in the specialty. Males cannot adequately relate to the problems that female patients experience, such as PCOS. They cannot adequately relate to things. That if not females were in this field, they'll be able to be encouraged to actually, because they know what their counterparts are going through. They know that they understand the pains of the entire process. They'll be able to actually direct more research into these areas. We think that it's going to increase the likelihood of all these diseases to be actually more adequately researched. I'd also like to talk about the fact that the abuse part that my partner mentioned. We think that there's an example where a dental surgeon sedated a patient because obviously she had a condition in her mouth. So they had to sedate the patient so that they could treat the condition. 9 months later, guess what happened? This patient came back and she was pregnant. The investigator found out that the dental surgeon caused the pregnancy. And this is even a matter that concerns the teeth. It has nothing to do with female private parts. Now we're talking about O&G. O&G has to do with female private parts. And can you see what I'm trying to say? It causes more harm. Because obstetrics and gynecology, and we have the opposition was trying to say that it is not true that male O&Gs, that we're not addressing the root cause, or that it's not true that male obstetrics and gynecologists can actually perpetrate these types of crimes. That is totally false. I'm sure everybody here has heard of a case where a male O&G maybe invaded a patient's privacy or invaded a female patient's privacy. These are things that happen commonly. So opposition comes to say that we're not addressing the root cause. I'll give another analogy. Would we say that cocaine is bad? We all know cocaine is bad, right? Would we say that if we limit or if we ban cocaine, we're not addressing the root cause of people's desire to take cocaine? No, we're banning cocaine because we want to limit people's access to it. So then coming to say that we're not addressing the root cause, of the problem is totally false. Then I'd also like to talk about the priority of the hospital. What is the priority of the hospital? Priority of the hospital is that patients are cared right. We also think that a particular priority is that patients feel safe. Patients feel safe to talk with their doctors, right? And we've had cases where, because of all of these atrocities that male O&G, because I'm not saying that all male O&G specialists, I mean male of course, and I don't think I'll do something like that by God's grace. So we're not saying that a male specialist is not going to be, or a male specialist, all those specialists are going to, because there are some bad eggs in the system, and because of this, they've made the entire system unsafe. Females go to their male doctors and they don't feel safe to actually talk to their doctors because another male killing a chick, like females don't feel safe. And I think that this male problem has actually contributed to the factor, has contributed to the problem. So we think that the thing that my partner mentioned that having an oversaturated specialty is not proper. Moreover, all the patients in O and G, they are all females. So all females in the world, and the only doctor is male. Let the math now, please. Let the math. So we think that if we have more females in this specialty, it's going to make it safer, right? It's going to make it safer for females to talk to their doctors more easily. It's going to make it safer for them to be able to confide in their doctors, right? Then I also talk about the fact that we need more female perspective in the field, right? Because if you have more female perspective, we have a case where females who can sympathize with their disease they feel more obligated to do research into this field, right? And this research leads to increased solution or better solutions to female problems such as polycystic ovarian syndrome, which has been heavily under-researched in recent years. Thank you very much. I would like to retrace the point, which is we regret the rise of male obstetrics and gynecologists. Thank you very much.
Thank you very much, Deputy Prime Minister, for that amazing speech. Now we welcome the Deputy Leader of the Opposition to finish the opening bench of the debate. Awolowo Franklin, here.
It regrets that I see that my opponent comes to this place and argue based on mere facts, which are not substantial. He talks about little research, but I will remind him that this research are conducted by males. Now, this research that he talks about are conducted by males. The first professor of O and G in Nigeria is a male. He's not a female here. And I'll tell you something. I was also involved in this crash on Twitter, and I'll tell you that I was also dragged. And I see some females calling menstruation ill. Now, imagine that. Let the math too. I'll tell you something. How do you expect someone seeing and things? How do you expect her seeing a natural body calling it ill? I want her to come to that particular department. I beg your pardon. And also, I'll talk to you about something. You talk about oversaturation. What
You are eating into his time, please. You are eating into his time.
Talk about oversaturation. But I put it to you that why are the females not venturing into that particular department? Why do they go to family medicine? Why do they go to other departments? I mean, why are males going there? Because what? The females are not ready to even take up that particular office, take up that particular stuff. Now you come to me, talk about miscarriage. Come, let me remind you something. Because the best person not to treat a miscarriage person, I will tell you this is a miscarriage doctor. Because he's going to be treating the person based on, I might have taken this drug, I might have been an issue for me. You don't have to say, I don't want to give it to this person. And that particular drug might actually help the person. How to think of it, let the math again. I'll take that later. So, moving on, as the second speaker, I have been told, apart from reflecting it, I'm also having the responsibility to also reinforce my speaker's speech. Now, my speaker talked about the private, when you deprive the right of someone. Yes, now let me explain something to you. After passing anatomy, physiology, biochemistry, other parts, chem parts, microbial, histo parts, after passing herbs and like after I take that later. After going through all the whole MB exams, you are telling me that you are regretting. After making decisions, you are telling me that you are regretting the failure. I feel you should think your things twice. You talk about she also talk about equal opportunities. I think that like that. She talk about equal opportunities. I tell you, yes, there is equal opportunities. If you look at our constitution is not gender biased. Our constitution talks about gender equality. And our constitution will never regret the fact of no rights. Because I tell you, as far as I am registered under NBCN, I am liable to make sure that I can treat a female patient because I have satisfied the examiner. I put it to you again. I'm moving on. I talked to you about limited skilled professions. Now you talk about the regret of male rise in herbs and dye profession. But I put it to you, if you remove male out of that particular field, because of the very much shortage of herbs and dye in Nigeria, I talked about chaperone. Yes. We talked about sexually abused people. I mean, the sexually abused victims. Ask them one by one. Is there any person supervising the doctor? I mean, there should be a chaperone. When I was doing my exam here, I'm in dentistry, but obviously I'm still in the clinical side, the medicine side. I still have a chaperone beside me when I'm doing my physical examination. I mean, we just come to this stage and tell them about sexually abused victims. But you don't check the underlying cause. I'm sure a chaperone will not allow a doctor to do some of those negative thoughts or negative things on the person. Now, moving on, we talk about consent. Yes, you know what consent means? Consent. Now, I'm 100% sure we understand medical legal. And medical legal means what? Medicine and law. There is what we talk about consent. You don't have rights, you don't have privilege. For the fact that you are human and you are coming, I take that later. But for the fact that you are human, you are a female coming to an Obs and Die hospital, you have every right to take consent. You have every right and privilege to choose who wants to treat you. You don't, I put it to you that there are some females that come to me, there are some female doctors that haven't done far half of what male doctors in Obs and Die have done. They come here to be regretful about what? My brother. Now, so, moving on, I'd like to summarize what we said. Now, I've said earlier, this is your POI. Yes. Now, let me remind him that the professor of Obs and Die, first Nigerian professor of Obs and Die, also had female classmates. Why did the female classmates not go to Obs and Die? Think about it. Calm down. Now, without dwelling on baseless and pointless arguments, I'll move to the last part of my duty, which is to summarize. Now, firstly, we've highlighted we've highlighted particular statements that which helps us to win this battle. The first one is equal opportunities. Every man deserves equal opportunity. The other one is maintenance of standards. Yes, deprivation of rights. Nobody should be deprived of rights. I have the right to, as far as I've satisfied the MCBN, I have the right, and nobody should be regretful about that because I have passed that particular exam. We talked about nepotism, to which we can sort out this. Chaperone, consent, rights, privileges. These are basic things that you can inform your patients. You can let people know about this. And yeah, that's it.
Thank you very much, Deputy Leader of Opposition, for that amazing speech. Now we welcome the closing half of the debate, the member of the government to come and run the speech for CG. Omotola Toluwani. House. It is of great concern that we are discussing an issue that affects many women in our society today, but especially in this part of the world. The field of obstetrics and gynecology is attributed to vulnerability and intrinsic attention to body parts. Unfortunately, this field is predominantly occupied by the male counterparts. My side of the bench is here to enlighten us and uproot all seeds of misinformation that the government side has planted here today. Today, I will be sharing with us reasons why we on the opposition side regret the rise of male obstetrics and gynecology doctors. Firstly, it has trampled on patients' rights to autonomy, right to choice. Patients should have the liberty to choose wherever they want to. Patients should have the opportunity to choose wherever they want to treat them. Patients should have the liberty to choose who should treat them because most of the time when these patients go to the hospital, the fact that male doctors have predominated obstetrics and gynecological units, they are left with no choice but to go there are many cultures in our society today that they try to say that a woman's body is basically for her husband. For example, the Muslims in the house or the Alajas in the house, that they try to curb women in the sense that men should not be allowed to just see women's body anyhow. There are cultures and religion that believes women's body are exclusive for their husbands. But if there are no women in the obstetrics and gynecological sectors, what can they do? What can these women do? What do you advise them to do? Which leads to my next point on the fact that it leads many of these women
Okay, Adeneko Yomi.
Hear, hear.
So, the House, I sincerely understand that this debate is emotional, but I also like us to be logical, because in a country that has a lot of reasons to, to make us regret. This regret is actually a luxury that we cannot afford. For a country where the ratio of doctors is 1 to over 9,500, instead of the recommended 1 to 600, this regret is actually too much of a luxury for us. That's the first thing I want us to actually get. And again, saying males or male doctors should not treat female patients is saying we want more female doctors to treat female patients. And we should also note the fact that there can be emotional traumas for these female doctors, because when a lady sees another woman going through the pain of childbirth, she can decide that she doesn't want to pass through this, and for that reason, she will not give birth or she will not even marry at all because of that trauma, basically. And why is this increasing? Why are we having a rise in male doctors? It's not because, it could be because females are not interested in this field, not necessarily because we're having more males. It can be because we're having less females. So we should not be treating the symptoms instead of the disease. Yes, human body is human body, either a man or a woman. If you go to the health center to Rashida and a nurse wants to inject you, most likely it will be a female. For a man like me, I'm actually feel somehow, but a human body is a human body, either a male or a female. Yes. Yeah. Someone said earlier, I think it's the Prime Minister that said, when a lady comes to the hospital, for example, he said a lady is not comfortable with the doctor, if it's a male and all that. But I put it to you that her emotional trauma is actually due to something else. Either she's been abused at home, either she's been abused somewhere. Her emotional trauma is not because of the doctor, but it is because of something else, something left untreated in her, basically. He also mentioned that there is tendency of abuse by doctors. Or, yes, he said there is tendency of abuse by doctors. I also want to quickly tell you that there are laws and regulation, and that is the essence of the laws and the regulation. Yes, from the opening government, I think from the side of the government, someone also said a man does not feel the pain of a woman, so he cannot cater, he cannot tend to her properly. And I put it to you that that is actually wrong. A woman at times can feel the love of a woman and be like, why are you shouting? Come on, go and sit down, so we have been through it. But a man does not experience it before. A man does not experience it before can be made to believe that it is reaching the heavens, basically. Yes. Instead of lamenting the rise in the number of male doctors, or I'm not taking it. Instead of lamenting this rise, I think what we should actually lament is the reduction or is the insufficiency of female obstetrician and gynecologists. And for a place like Northern Nigeria, for example, that females are not really allowed in school, and they have large population, and they have
One house, please.
And they have large populations, and females are not allowed to really go to school. How do you cater to their need? The problem is not increase in male doctor. The problem is insufficient doctors primarily. Yes, I think a member of the government also said males have done harms to female patients, like abuse. You did not give us any data to that. You just assume that because you told us, we should take it for that. There is no data to support that, because females can also do that. Although people suspect males, we have lesbians in females. So basically, You have to put point to actually drive that home, basically. Yes, and if you say males are actually doing harm, in your opinion, if you say males are actually doing harm, then we should remove them totally. That's the point. Because if you say yes, what we are regretting is the rise. We are not regretting the presence. And we should not basically regret the rise. Because if we regret the rise, it means we want to make it equal. If you make it equal, you don't take away the harm, basically. You might remove those that are not doing harm, in the sense of making it equal, and leave the dangerous ones there. Yes, I think from the closing government, she said patients should have the right to choose. Patients actually have the right to choose. That exists already. You can always choose. No, I'm not taking that. She also said, a male wants to dominate. Male wants to dominate. That is a lie. That is a lie that cannot be substantiated. It is women that are not taking it up. It is women that are not basically taking it up. And she said one thing, that it is an obvious lie. She said, chaperones are always male, men. That is untrue. That is a lie, L-I-E, because chaperones are intentionally women when male doctors are treating their patients. So I want to tell you that finally, saying this regret is actually a luxury we cannot afford, especially in this country. Thank you.
Thank you very much, member of opposition, for that wonderful speech. Now we call on the government whip to come and round up the case of the government bench. Hear, hear. Adebayo Godman.
House. As we conclude this debate, it is quite important to note that, and it's quite unfortunate, that all sides of this debate they've structured this debate strictly to gender and sexual violation. I want us today to understand that the rise of male doctors in O&G come back to patriarchy and broader issues such as gender inequality and structural bias in the medical system. I urge us today to regret this trend. Today, I am going to be producing rebuttals to whatever the opposition side have said today. The opposition side may mention that there are equal opportunities for both male and female doctors. They don't understand that aside access to education, there are a lot of things involved in choosing a specialty, such as access to mentorship programs, access to scholarship, access to a lot of things. Female doctors do not have access to mentors because these perceived medical elders think women, what do you want to come and do in this place? They will rather male mentees. So this does not produce a fair playing ground for these people, for female doctors per se. The opposition side also made mention of ratio, that there's a certain ratio of doctors. It is quite unfortunate that this side of the bench cares about ratio rather than patient autonomy. Patient autonomy is the core of medicine, not ratios and all. Opposition side also made mention that limiting the number of men and all of that. I want us today to understand that we are not here to limit the number of males that can venture in O&G, obstetric and gynecology. I want us to know that we are advocating for equality, basically. We want more women to venture into this branch of medicine, such that patients can have autonomy and can decide whoever they want. If they don't mind male doctors, no problem then. But we want them to have a choice. Opposition side said something very funny. They said, these women concerns are minute and they are not solid enough for us to regret. Rape is minute. Psychological trauma is minute. Violation is minute. These are all causes of regret. Opposition side also made mention that there is no direct connection between obstetrics and gynecology and sexual violation. I want us to know that obstetrics and gynecology is almost always invasive. You have to be involved with this patient's body. So there's a direct connection. You have almost all access to this individual's private part. No, please. Lastly, on my rebuttals, the opposition side said human body is human body. That's quite ridiculous, I must say. If then, why do you have a branch of medicine specially allocated just for women, if human body is human body? Because I believe we have considered women as very delicate, such that we can attribute a whole branch of medicine just for them. And I believe we should encourage people who feel these things, who experience these things, this ache, this syndrome, whatever it is, we encourage them to be wholly involved in this branch of medicine. I'll be buttressing more on what my partner in the closing government has said. She made mention of precedents of history. We are not imagining a problem. We are here stating a problem that already exists. In O&G, male doctors usually, not all the time, usually violate female patients. We are not creating something up. There is, in Nigeria, all over the world, not in University of Medical Sciences, we've had history of male doctors violating female patients. So why are we here saying it's not something of regret? It's quite unfortunate. My partner also made mention that as stifled innovation in women's healthcare system. Almost all branches of medicine, we've seen advancements, like incredible advancements. But then in women's health, it's quite unfortunate that we are doing the same thing from 20 years ago, 30 years ago, 40 years ago. Do you know why? Males are inherently selfish. They care mostly about themselves. So there's no reason for them to be wholly involved in this women's healthcare system. So if we encourage women, or we remove all patriarchy system surrounding, all patriarchy system that is inhibiting women from participating in this, or from venturing in O&G, I believe there will be innovation in women's healthcare system. My partner also made mention that the rise in male obstetrics and gynecologists has downplayed women's religious and cultural beliefs. There are certain religions, certain cultures that do not allow you to reveal your body parts to anybody except your husband. Now, this is a scenario. This particular woman, per se, that is not allowed to allow any other male to touch her, goes into a medical facility to see a doctor full of male gynecologists. What does she do? This has reduced women's approach to the healthcare system because they know that eventually they will not even be able to get the attention they need from these individuals. PI.
Time up.
This has just revealed the ignorance of this other side of the bench. Menstruation does not affect your psychology. You are a professional, for goodness sake. Lastly, my partner made mention. It has trampled on patients' autonomy. The core of medicine, I say, is patient care and patient autonomy. We are not here saying, this other person was saying MDCN. You can't go. Nobody is asking you not to go into obstetrics and gynecology. All we are asking for is equality, such that patients have the right to eventually choose, I want a female doctor, and they will get a female doctor without questioning. As we conclude this debate, As we conclude this debate, I hope I've been able to give you enough reasons onto why we should regret in male doctors in obstetrics and gynecology. Thank you.
Thank you very much for that wonderful speech from the government whip. Now we're going to round up today's finals by introducing the opposition whip to come and round up the debate. Peter Eniola Oluwanimi.
Good afternoon, House. I am the opposition whip. Today, I will clarify these debates and refute the government's case and also prove why my team's argument is the most impactful contribution. In the info slide, we were told about 4 different points before the motion, which says that the House regrets the rise of male obstetricians and gynecologists. The first point was regarding gender equality, which the government said has emphasized over and over again. However, how do you enforce this equality without disproportionately reducing the number of men in this profession? You speak of inequality, but who is stopping women from going into this profession? Nobody, absolutely no one. If you follow the conversation on Twitter that day, a lot of female professionals came out that day to speak on, oh, they don't want to do O&G. It is smelly, it is this, it is that. Without the males in this profession, O&G would not be a thriving specialty in Nigeria. To speak on the maternal mortality rates, we know that that was one of the reasons why this Mother and Child Hospital was created in Ondo State, to challenge the rising trend of maternal mortality. However, where were the females in their whole regard, right? We've had a lot of female doctors, female medical students. Rather, they don't choose to go into 1G. It is not because anybody is stopping them. There is no limitation to women going into 1G. It is simply choice. And if they choose not to go into it, coming to this house to regret the men who have made impacts in this trend, it is insulting to the men in this profession. And it is not something this house should go into. The second point, later please. The second point was regarding male medical students examining patients. We all know that O&G is one of the core pillars of medicine and surgery when we study it in school, right? So to limit male students being there when the patients are being examined would be unfair. And it will give undue advantage even to the female medical students. Because at the end of the day, the females will end up being better at that field. But nobody says, oh, because they may not end up going into that specialty later, they will still do the MD together. So you are talking about gender equality, but you are also advocating for females to be better at O&G than men. So at the end of the day, we'll produce, if we go by what you are speaking of, we'll have females who are doing better in school. This has nothing to do whether they will still go into O&G later in the future or not. Because people come out with distinctions in O&G and still choose to go into something else. So being in school and going into the ward to see this patient doesn't actually translate into them going into that field. And they also spoke on patients' rights. Nobody impedes on patients' rights. Patients have decision to say they don't want to have the male medical students inside the ward. That was actually what sparked the debate on Twitter. The male medical student was speaking of how he does not learn enough because most of the time they send him out. So now I'm asking you, how exactly are you saying patients' rights are not respected when it's reached a point where male medical students are already feeling like they're not even learning enough? It means that those rights are actually being exercised. If they were not exercised in the first place, male medical students will not be complaining that they are not learning enough. And regarding the one of doctors too, you spoke on cultural and religious preferences. You can choose to see a female specialist if you want. Nobody stops you, nobody hinders you. Then the Prime Minister spoke of, the Deputy Prime Minister or the Prime Minister spoke of a dental surgeon that raped a patient. So are we going to say no male should treat any female? Because that's where you are going to. You are saying that, okay, because a dental surgeon raped a patient, so males should not be in O&G. So are we going to limit all males from seeing all females? So we should only have female doctors treating female patients. We are going to have a situation of Afghanistan, and that's what happened. This is not Sharia law. We are not living in a country like Afghanistan where that happened. And we all saw we all saw what happened on Twitter, the uproar. Females are not even allowed to go to school there, which is like what we have in the north. A lot of females don't go to school, and then there are a lot of pregnancies. There are a lot of females having issues there. So what is going to happen to them? At the end of the day, we're going to have a lower healthcare. Like my partner mentioned, the doctor-patient ratio is very, very low. This is a luxury we cannot afford. We have today, if you want to go into any specialty in Nigeria, it is easier than ever. Why? Because there are not even doctors to go into these professions, into these specialties. So it is not because males are dominating anybody, like somebody said. Nobody is here to dominate women in it. It is simply because women are not interested. POI, please.
Your partner mentioned that females do not want to go into this one issue. But this is over-generalizing because the fact that developed countries, there are way more who are specialists than they are males. So are you sure you are not over-generalizing, or are you sure that this is something due to cultural?
Which woman has been denied entry into one that you know? Name one. If you cannot name one, that point is moot. Next POI, please. No. Okay, I proceed. The member of the government spoke about how males cannot relate well to the pain. Again, I referenced the conversation on Twitter. There were also women who said males treated them better for the pain because they have not felt it. Females also have experiences of when women would tell them, I have experienced this thing before, it's not that deep, it's not just cramps, why are you shouting? Females have a tendency to do that more. So if you want to bring up that argument, it will not fly because there are opposing arguments from other side. To come to this house to regret the rise of male obstetricians and gynecologists will not be fair to those who have labored in this field. And my opponent also spoke about how females don't have access to mentorship and scholarships. I'm here to tell you that categorically that is false, heavily false. Women have more access to scholarships than men. There are many scholarships that we see that they say only females, only females. How many medical associations do we have that are catering to females? Even in the Nigerian Medical Students Association, we have a standing committee for something related to women. So that point does not actually follow. It is false and it is a misrepresentation of facts. Lastly, speaking of all access to private parts, that is, again, I'm going to emphasize the use of chaperones. That is why they are there. They are females. Nobody can do things when chaperone is there. So to generalize it is not good. Thank you very much.
Thank you very much. Opposition whip for that wonderful debate, and that rounds up the finals of the debating championship. Thank you very much, all speakers.
Please let's put our hands together for them again. That was beautifully done. Right now, in the next few minutes, the adjudicators will be excusing us to put their eyes together so that they can come up with whatever they have. It's a sort of interlude now. While we wait for them, we have some comments on what we just experienced, and then there's also going to be a poem about Unimed that we will take. Maybe some comments first on what we just listened to. Let me start by saying that they've all done very well. Or you disagree with that? Do you disagree with that? Good. Please let's put our hands together for them once again. For me, I listened intently to the arguments from both sides, and I think I've learned a whole lot. I will just pass some comments without making any particular reference to whatever they have done. Based on my observations. There's something we call love connectivity either in debate or public speaking. And what is this law about? It is about your ability to connect with your audience. It is your ability to make your audience to want to continue to listen to you over and over again. They pick your point, they do this. I observed something while they were debating. Somebody used the word I'd wanted to use at a point, that overgeneralization. Okay, I think I heard that. Most of you use a lot of isolated cases. I was expecting some statistics to back up what you were saying, okay? The XYZ number of women in a particular place, XYZ number here, but what you were doing, if somebody was saying it there, that, you know, women, they feel it more, they know what they are saying, they act. How many women? Can you take an environment and give me statistics, particularly in a parliamentary house, that ultimately you want to lead society into a particular area? There must be facts and figures coming from you to back up whatever you are saying, okay? And I also noticed some of you became emotional at a point. In a debate, when you are emotional, it's very easy for the other person to actually knock you off the radar. In philosophy, they call what you will do to that person reductio ad absurdum. That is reduction into absurdity. The moment all you do is that you become tensed. No, let me make this point. Fine, you may have good points. All the other person needs to do is just to raise something minor, and then you want to fight back. In the process, you may not get yourself again. And as parliamentarians, okay, you are not just arguing because you want to argue. You want to make the society a better place. You have picked an area. I was also expecting you to raise questions using Socratic approach, the Socratic method of debating, and then begin to raise questions. Is there any restriction placed on women in our society, in the society that you are talking about, not to take to that field? That's one solid question we need to first know. If there is none, that one will be arguing on intentionality. It's because we want to make society a better place. Can we then become intentional and then say, we want more women in this particular area? That's really because they are being abused. You mentioned sexual abuse over and over, and without any statistics. Maybe for somebody that mentioned one dental surgeon did this, how many have been raped? How many have been abused? And because this is on the increase, there is a need for us to do X, Y, Z. Statistics can actually help us what we have. Perhaps because most of you did not take, when they raise hands, they will just ignore. So I won't abuse you, I won't accuse you of not using spontaneity law. You did well in that area. One guy was able to knock the other one straight by coming up with a better argument. Sincerely, you've all done well, and I think it can only get better as we proceed. Please, once again, let's appreciate them. May have gained a lot from you, and I'm also giving back. All right, now I'm going to call on the person giving us a poem about Unimed. A poem about Unimed. What's the name? Okay, and they didn't put down the name. I asked her a question when they told me her name, Dapo Karonwi. For Dapo Karonwi to be rendering a poem, you know the meaning of Karonwi? That means she has something to say. Let's listen to what she has to say about Unimed. A round of applause for her.
Good afternoon, everyone. I am Dakwakaranwi Oluwabukalami, and I wrote a poem to celebrate the 10 years anniversary of Unimed's excellence. So I'll go on and I'll read it bit by bit so we can follow up, because it's not going to be projected. It is a decade of excellence, a legacy born. Moving on with life, the rising of a new dawn. A groundbreaking institution, a leader in medical excellence. Unimed stands tall in our vision in good health defense. Founded by a doctor, a statesman of renown, who served as a leader far beyond the four walls of this town. His passion for healthcare bears a beacon of hope, inspiring generations to strive, to read, for others to cope. With a commitment to preeminence, the school took its stand, a hub for academic rigor, where brilliant minds expand. They are trained to heal, to comfort, and to care for humanity with love and compassion that's rare. As we celebrate this milestone, we honor the foundation, who through thick and thin founded this institution, with knowledge and experience to make a difference in the lives of patients, the community, and the universe. With courage, I say today that we will face whatever challenge that comes to our way with a fast pace. Upholding the heritage of exceptionality, we move from lemon to lemonade as we journey through the next decade of this school. Happy 10th anniversary, Unimed. May your legacy shine, a testament to the power of hard work, vision, and design. I pray, may your impact be felt far and wide, a pathfinder in medical education, forever to abide. I want to remind us today that we are Unimed. The students they are training, we are Unimed. And when I say that your impact will be felt far and wide, I am talking to each and every one of us here. Thank you.
Wow. Please let's appreciate her one more time. So we are moving to the next item here, which is public speaking. Public speaking finals. Mrs. Sholanke will be handling that and setting the tone. Me, I'm interested. I want to go and sit and then listen to the public speakers in the house, the next generation of public speakers. Please appreciate Mrs. Sholanke as she takes over from there.
So I'll be calling the participants that made it to the finals of public speaking. I'll be calling them in the order in which they will be speaking. The first person that will speak is Nona S.L. Gene. Please come to the front here. Adjudicators for public speaking, please take your position. Shall we please rise as the Vice Chancellor comes to the podium? Please, with a round of applause, let's welcome to the room our Vice Chancellor, Professor Adesha Gofatusi, FAS. Thank you, sir. Welcome, sir. So, Nona, you are the first person to speak. The second person is Oluwashino Ayomi Makiwa. I am not announcing the faculty because we are not judging by faculty. The third person is Afolabi Ayomikun. And before you accuse us of being gender biased, the only male standing is Adebayo Godman. The public speakers will be speaking for 5 minutes. The topic they will be speaking on is Overcoming that fear. Overcoming that fear. So welcome to the stage, Nona S. Ogene. Please. Joining this adjudication is Dr. Ogundeji. Please put your hands together to this part. And Dr. Rachel Ololade. The session is chaired by myself, and we have other student adjudicators in the house. You have the floor.
When I was 6, I hated spiders. I hated them so much I could pass out from the mere sight of them. My mother said I was scared of them. You see, that time I did not understand fully the concept of fear. When I was 16, I had stage fright. I would get on stage and freeze in place, my fingers trembling and my heart palpitating. I couldn't, no, I just couldn't. What if I make a mistake? What if I don't do well enough? But I loved to speak. I practiced in front of the mirror and in the bathroom while I was bathing on the weekdays. I would sit my friends down to listen to me speak. But every time I was handed a mic, I forgot my words. I would strip myself of my accolades. I would stand bare in front of a crowd, ready for them to hit me alive. You know, one day my friend said to me, "No one hears the screams of the silent." But I'm not silent. No. I don't want to be heard, because I know to be heard is to be perceived, and to be perceived is to be judged, and to be judged is to die. I'm too scared to die. Then one day, while I was practicing, usually in the bathroom, I saw a spider at the corner. And then I remembered 6-year-old me would have been scared, trembling at the corner, shaking, shivering to her bones. And then I thought, what made me overcome that one? Is it that I realized I am too old to be held back by such mediocre things? Or is it that I acknowledge that I refuse to be held back by something as little as a spider? So when I was 17, I went up on stage to give my first public speaking. I did it scared. I did it glasses off, unable to see the crowd. I did it fingers trembling and trying to ease my palpitations, but I did it. And then I made it to semi-finals. And after then, I made it to finals. And then I got 5th out of 5 people. But the next time I did it with nothing to lose. I did it freely, with nothing holding me back. Audience, what is that fear that is keeping you at the corner? What is that fear that is crippling you, holding you down, unable to move? Are you really going to let something as minor as that set you back? Are you not bigger than such mediocre inconvenience? When will you become 6-year-old me who acknowledged that her fear of spiders was too little to hold her back from becoming who she wanted to be? When will you see the spider at the corner and then kill it with your slippers? Audience, things like this are too small to be holding us back. You are scared. Do it scared. Do it tired. Do it unsure. Do it ready to be judged. Take your glasses and put it on the podium. Block your ears and don't hear the murmurs of the crowd. And then when you are done, walk away so you don't even have to see what people have to say. But do it. And at the end of the day, when you have done it, you know that you can look at yourself in the mirror. A man proud of his countenance, ready to take on the world on his shoulders, and not held back but by something as tiny, as little, as something, as an inconvenience that you think is bigger than the world. Audience, you are bigger than it. Whether you like it or not, you were brought to this world to trample on them. And the moment you acknowledge within you that you can trample on them, that is when the trampling begins. So start now. Thank you.
Thank you for that energetic one. Welcome with me to the podium the next speaker that will still be speaking to us on overcoming that fear. Makinwa Oluwashinu Ayomi. A round of applause for her, please.
I am scared. Oluwashayomi, I'm scared. Can I do this? Shayomi, you are here already. You can do this. Ow, just face the crowd. And here I am today. So I'd like to start with a greeting. Panel of judges, accurate timekeeper, co-debater, fellow competitors, distinguished ladies and gentlemen. Today, I'm standing before you to talk about three important words, three incredible, powerful words that affect each and every one of us today. Overcoming that fear. What does it mean to overcome that fear? Overcoming that fear means for you to rise above your fears, for you to trample upon your fears. September 14th, 2009, at Abuja. I had the opportunity to face a large crowd. That was the first time I had the opportunity to face a very large crowd. I was so scared. I know how many times I had to go to the toilet because I was so nervous. I had running tummy, all because I was scared to face the crowd. I sweated profusely that day. My palms were very cold. I know I'm not the only one that have gone through this. Please, can you raise your hands if you've been through this before? Perhaps you've been scared before to overcome your fear, to face any challenge, to face your fears. And please, I don't want to tell you how many times I've been to the toilet today to face the crowd today. But here I am, doing it scared. How many of you have heard of Oprah Winfrey before? Thank you very much. Winfrey was sacked from her first job as a TV presenter because she was so nervous at set. But now we know who Oprah Winfrey is, right? She was on the Alcott Michelle Obama's program, documentary on becoming. And we see how great she has become. So this is a challenge to each and every one of us here today. You can do it. Don't let your fear rob you of opportunities. You have so much in you that you cannot let fear take away from you. How can you overcome your fear? Number one, face it. Walk through it. Even though I walk to the valley of the shadow of death, I will. So walk through it. You were made for more. Also, develop your resilience. You don't get it the first time, do it again. We have the likes of Thomas Edison. He discovered light bulb on the 1001st attempt. He failed the first time, he did it again. The second time, he did it again. Develop your resilience. Practice, practice, practice. You can go and learn through it. And I want to tell you, instead of fear, replace with faith. You have so much in you. God has created you to be so much that you cannot become less of who you are. Don't let fear rob you of who you are. Courage is not the absence of fear, but rather it is the judgment that something else is more important than fear. You are 26 years old. You are so enthusiastic about genetic engineering. Don't let fear stop you. You are 21 years old. You want to make impact, but you are so scared. Don't let fear stop you. You are 20 years old. You want to change the world. You can do it. Go for it. Fear is temporary, I tell you, but regret is permanent. I don't know how many of you are here today. Maybe perhaps fear has stopped you from doing one thing or the other, and you are sitting here regretting it today. You don't want to let fear make you regret any other opportunity again. Fear is temporary. Regret is permanent. So why wait when you have to regret decisions? Why wait when you have to start looking back and start lamenting? Had it be had known. Instead of fear, replace with faith. Face your fears, surmount your challenges, walk through it. Practice, develop your resilience. You can grow and learn through it. Don't let fear stop you. You are a unique fingerprint, a very special DNA, and you don't deserve to take your greatness to the grave. So, today, why don't you take a leap to overcome that fear? Take a leap today to overcome that fear. Because fear is temporary, but regret is permanent. Thank you.
Thank you so very much for that wonderful and powerful speech. We move on to the next speaker, by name Afolabi Ayomikun. A round of applause for her, please.
Fear. For me, fear has always been coming up to the stage to speak to a loud crowd of people. Scratch that. Fear is me standing here and speaking to all of you one by one, looking at your faces, making this speech. Right before I came up here, I was shaking. For a long time ago, since a very long time, anytime I think of coming up here to speak, I start shaking, I start jittering. My body is filled with goosebumps. I can't talk, I can't move. I was paralyzed. Every time I think of public speaking, I say, no, public speaking is not for me. I can't do public speaking. I will fail. And one day, something changed. I know you are asking what changed. Why am I standing here if I am scared? Something changed. A conversation changed me. I had a conversation with one of my friends, and she was saying that for every public speaker that stood on a stage to speak, they would tell you that the first time they spoke, they were scared. Down to the stage where they came to speak, they were shaking with fear because they did not know what to say. They felt, oh, they will fail. She said that everybody will tell you that the only way you can overcome a fear is to stand and face that fear and do it. You do not need to be brave to do it. You have to do it scared. She told me, Miko, you have to stand up and speak. You do not overcome fear by just thinking that it is scary. The more you think about it, the more the fear cripples you. You cannot say you want to overcome a fear. You cannot say you love public speaking, but yet the fear, you are thinking of it, oh, I'm scared, I can't do it. She said, Miko, you must speak. And I said, okay. I was like, oh, I will do it, I will do it. Then an opportunity came up. I saw the flyer for this public speaking competition. I was like, can I actually do it? She forced me to register. I registered. The first time I came to speak, I almost wanted to turn back. I was like, I can't do it. I am too scared. What if I fail? What if I disappoint my entire faculty? I'm not doing it for myself, I'm doing it for my faculty. What if I disappoint them? I was like, but I stood up, I went. I spoke, my fear was at 100% high. I was shaking, my words were not coherent. By the second stage I came up, my fear was at 40% because I saw that, oh, I made it to the second stage. Meaning there was something I did well, right? I came up here, I spoke. By the third time, my fear was at a 40% level. I was like, I can do it, I can do it. I made it to the finals. Standing here today, I'm not saying I'm not scared. Before I came here, I was praying because I was very scared. I am very scared. But I have learned that for me to overcome fear, I must do that thing. If I say that I want to continue thinking about how scared public speaking is, would I ever overcome that fear? I will continue thinking, yes, public speaking is very, very scary. Public speaking is a lot to do. But if I keep on thinking that, would you see me standing here today? My beautiful people, I can see beautiful ladies and gentlemen here. The only way you can overcome fear is to do it. Somebody would say, do it scared, do it tired. No matter what you are doing, just do it. My chief would say, she would say, no matter what you are doing, just start. It doesn't have to make sense. You might not even feel that you can do it. You are scared that you would fail. Just do it. Fear is not tangible. It is an abstract now. Why is something abstract holding you down? Why is something that you cannot even touch holding you down? Is it a chain that is holding you down that you cannot speak up? The only thing that should hold you down is if they tie you to that chair. That is when you will not be able to come up and speak. A lot of people are carrying potential they are supposed to birth, but just because of fear, that abstract emotion that you cannot even touch or feel is what is holding you back. Why? You have to stand up. Do it. Say, yes, I can do it. My Bible tells me that I can do all things through Christ who strengthens me. So what is fear? What is fear? Something I cannot touch? Something that cannot touch me? Why am I now scared? So I came up here and I said, yes, I will do it. I can do it because I have who? I have God. So why am I scared? You can only do it if you say, I am going to do it. If you don't stand up on that stage to do it, you would never overcome that fear. And I'll leave you in the words of W. Clement. He says that when you continue to think, thinking will never help you overcome that fear, but action will help you overcome that fear. Thank you.
And to wrap up this side of the competition, welcome to the podium, Adebayo Godman.
I still remember the first time I had to speak to a crowd. My heart was pounding, my fingers were sweaty, and my mind was filled with 100 thoughts. What if I fail? What if I get judged like I have judged others? I stood there frozen, unable to speak a word. It was as if I had lost control of my body. It was overwhelming. It was. I remember saying to myself, I'm done. I'm not cut out for this. I'm going back to wherever I'm coming from. But then I did it. I spoke. I did not speak well, but I spoke. It was not easy. It was not pretty. But something changed that day. I faced my fear. I faced it head on. You see, fear for me was a giant. It was something insurmountable. It was something I could not beat. The idea of standing in front of others, the idea of being naked, the idea of being judged, the idea of failing, the idea of not being good enough, the idea of not being able to express myself like I was talking in my head. I was scared. But deep down, I knew this fear was not going to go away. I knew it was something I had to face head on. I knew it was something I had to start small with, I guess. I'll call my friends if they want to listen or not. I'll start a discourse. I'll speak to them. I started small. I would engage them, even if they were interested or not. I knew I just had to start. Eventually, I got my chance. I got my chance to speak to a huge crowd. I was still not ready, but I got my chance. I realized that if I did not try, I was not going to be able to know what I was capable of. I knew that if I did not try, I was going to lose it all. I was going to become a catalyst for failure. I chose to face the fear, and I won the fear. The next time I had to speak, I was nervous. I was still nervous, but I was not as scared as before. That giant had gotten smaller. I was defeating that giant gradually. The more I practiced, the more I realized the less that the whole process of speaking had become less intimidating. That had become easier. I was no more sweating. I was no more thinking of what people would say. I was no more thinking of what others have to say. Over time, my fear transformed from something that paralyzed me into my comfort zone. Public speaking became what I always wanted to do. I always wanted the chance to speak to a crowd. Here I am today, speaking to you. Well, I am not a motivational speaker, but I'm here to just give you a few tips to help make your fear smaller. First, acknowledge your fear. You need to understand that the fear exists. When you acknowledge, you are 50% done with the fear. Then you start small, like I did. I started with my friends. Ronaldo is better than Messi. Manchester United and Chelsea. I was not interested in that discourse, but I wanted to talk. I wanted them to hear what I wanted to say. I wanted to talk to an audience. I just started small. And then I prepared and I practiced. With my friends, with the mirror, with myself, on the road, I was always talking. Such that I can stand here today and speak to you all. And the last thing is to push through the initial discomfort. It's never easy. Speaking is never easy. Starting something new is never easy. Starting that business enterprise or venture is never easy. It's uncomfortable, but just push. It gets easier. It gets better. Now I stand before you today, not because I've eliminated fear from my life, but because the giant has finally gotten so minute, it does not bother me anymore. What is to feel like an insurmountable mountain no longer overwhelms me. My note to you today: the next time you face something that scares you, the next time you face something that troubles you, whether it is speaking in the public, whether it is starting a business, whether it is writing an exam, you just need to start. The more you face it, the more it gets smaller. I'm not telling you fear will disappear, it won't. But if you keep showing up, you would win. Thank you.
Put your hands together. We can do better. And with that, we've come to the end of this session. The adjudicators would like to meet now.
Thank you very much. Please let's put our hands together for the public speakers. Now, while the public speaking competition was going on, the Vice Chancellor and the Deputy Vice Chancellor Academy came in and permit me to quickly recognize them also in our midst. I recognize first and foremost the Deputy Vice Chancellor Academic for a reason, because I'm bringing the vice immediately. Please let's put our hands together for Professor Rose Angela Nwuba. If I know two people who are fearless, if I know two people who have succeeded in overcoming any form of fear in life and in whatever sphere of life you may want to think of, our Vice Chancellor is actually one of them. He's actually one of them. And if I've also worked closely with anybody who understands the power of public speaking, the power of eloquence, who can articulate issues in such a way that people will be moved to take action immediately, I think the Vice Chancellor is also one person that I've worked with. If you were on the convocation ground on Thursday, or you were with us at Odoshida, and you listened to him speak, that day, you will know that Demosthenes, that man, the Greek orator that people will always arrogate so much importance to, lived at a point he shouldn't have lived. He should have come at this time and then come and meet a match. No. I got so many calls based on his speech, those that watched online, asking me, are you sure that your Vice Chancellor is actually a medical doctor? I said, yes. I said, I wish you were with us 2 Fridays ago during the handover of the guest house to us. He didn't look at any paper. He spoke so well that one of the statements he made that day has now become a quotable quote for all of us. Even the people there, KBSC looked at him. I could see the way they were admiring him. And that's to tell you the power of the gap. If you can communicate well, then you can stand before anybody and make your points known. Now, if we have such an individual as our Vice Chancellor, it's only appropriate for us to formalize what we are doing. And it moves from just becoming a mere exercise that we do every year, and we make it a real club. To do that for us, distinguished ladies and gentlemen, today is no other person than the one you know, than the one I know, than the one I don't want to call Cicero of this place. You know Cicero? How many of us know Cicero in the house? God bless you. Only one person knows Cicero. I said you need to move beyond just medical books and begin to read other books. You listen to the VC speak, and then you see a man who has traversed every area of life, even through books. Please let's put our hands together as I bring to this side of the divide Professor Adeshegun Fatusi.
Thank you, PRO. I'm not sure I have many things to say. Okay. My colleagues on the ITV and our wonderful students, good afternoon. I have actually enjoyed listening to the teams. They just reminded me of the first time I had to speak. I had to preach in a small gathering. I think the preaching must have, I think they gave me 30 minutes. I think I stopped when it was 15 minutes because I was drenched in sweat. I was so drenched in sweat, like. So for me, I really don't want to say anything this afternoon. I think we've had some great time listening to some very powerful presentation. And I think and I hope that you know that what they're saying is not just about public speaking, it's about everything in life. If you don't start, you don't get there. The guys, the brother that started with the aeroplane, they didn't think they were going to fly much. People didn't believe them, but they did it because they believe in it. And I've always told people, you know, one of the things to understand about life is when you are able to understand the capacity that you have, when you are able to understand the potential that lies in you, you will get to a level where the confidence to do things becomes heightened. And so for all of us, whatever that dream is, you can start. I'm just re-echoing the beautiful arguments of the team. Whatever it is, you can start. If you never start, you will never get there. You know, there are many times in my life I thought certain things are not possible. Let me tell you a story. Let me tell you a little story about this school. I'm struggling my head if I should tell you the story. Yeah, let me tell you the story. You know, when I came to this school, 2020, we had, you are here. She was there. We had a situation where for 5 months, salary had not been paid. And the future was looking bleak and bleak and bleak. And one day we took a decision, management, that one way to change things is to financially re-engineer the institution by changing school fees. At that point in time, we knew Akumba had changed school fees, and government asked them to go back, go and change the school back to what it was. And yet, we needed to make a decision. For us, it was life or death decision. It's either this school survives by us being able to convince people that we need more money, or the school will die for lack of money. But we knew everybody was going to shout our name. Everybody. And we took the decision to see if we were going to increase school fees. And hell got loose. Everywhere, my name was just flying in the wrong direction. You know, and then the student union from across Southwest, they came. We had a meeting with them. And they said to me that they started by saying, you are such an idiot that you come to a school and increase the school fees. And I sat down there. I was looking at them. And they went on like 15 minutes. Who is your father? Who gave terrible baths to celebrate? And they went on, and they went on, and they went on. And I look at my team. Professor Nguba was there. Dr. Osho was there. And these are people who will not take insult from. So I wrote a piece of paper to all of them. I said, nobody will talk at this meeting. I'll be the only one that will talk. So when they've talked for like 15 minutes and abused me, and cursed my father, and cursed my mother, I was just silent there. When they almost finished, then they said, we'll make sure this school gets closed down if you don't change your decision. So at that point in time, I replied there, I said, don't bother to shut the school down. I already shut it down, and I won't reopen it until then. Like, oh my God, idiot, you closed the school down? And they started again. I remember the governor called me one day and said, Sheikh, where are you? And I asked her, I said, I'm Ondo. He said, come to Akure. So I got to the governor's office. And he pointed to a table. He was there with the Secretary of State Government and the essay on industrial relations. The table had paper piled like this. He said, Sheikh, every paper on that table relates to you and your school. It's a protest letter. So he said, what do we do? I said, nothing. We won't do anything. I said, nothing. He said, you mean we should not even reduce a bit? I said, no, sir. Because if you start reducing, there's no limit to what you can reduce. You know the point? That decision was not easy. That decision was not palatable. We knew there were going to be crises. But we also knew that if we don't do what we need to do, we are going to lose the opportunity of building a great institution. I've told that story for a simple reason. Almost every difficulty in life will challenge you until you decide to challenge your challenge. If you don't rise up, I always tell people, I will not, for the fear of failure, not attempt to be successful. And so whatever it is that you are confronting, believe me, you are not the only one. All of us have things that confront us. But it comes with understanding the context of what you're doing. Why am I doing this? What do I have to gain? What do I have to lose? There is no gain without pain. It is true about fear. It is true about life. And so for me, listening to the speakers today, I've learned a few lessons. I've learned that I can confront my fear continuously. I found that practicing help me to be able to stand stronger and make my giant to become smaller. I've learned from them that it may take me sweating, it may take my heart palpitating, but I just need to do it. I do hope you have learned that. And I hope you can go in that spirit and accomplish great things. Thank you. God bless you. So, I've been asked to do one other duty. So for me, one of the reasons why I'm excited about this, I'll tell you another story and I'll stop. Okay. A couple of weeks ago, she was telling me, you about what happened 5 days ago. And I'm saying that from a different context. That, number one, I want to thank you for being here. And I want to congratulate you for being here. I do hope that this platform provide an opportunity for all of us to grow our skill. None of us is perfect, but we all can grow our skill. And it is that mindset that I want to do this lunch. I was going to tell you a story. I'm glad she came in. When we got to the donation, the wife of the man who donated the house told us she was not very happy about the house, that they are donating their only house. And she said, by the time I finished speaking, she was glad that they donated the house. And she said, what more can we donate? What more can we build for your school? Lie? I was going to. He said, what? He said, bring the bill. What can we do? Can you? I know, I didn't say much. The Spirit of God helps me. He always helps me, by the way. The Spirit of God always helps me. But there's a point about it, is that by the power of our word, we can get doors open. Of course, by the power of our word too, we can also get doors shut. So for us in the management, we believe that part of growing young people to be able to be globally competitive in this age is to provide a platform where they can practice public speaking, where they can learn public speaking, where they can develop capacity in public speaking. And that's why formally today, we are not just doing a debate, or we are not doing a public speaking, we are not doing whatever. It is formally to launch this as an integral part of the program that the Faculty of Health, Law, and Humanities will be doing. And so this faculty would have that responsibility to make this a part of its regular program. Why is that important? Because if you just leave the program floating, sometimes it will happen, sometimes it won't happen. We want this to be something that will continue to grow and where every young person will have an opportunity. Just like already we are forcing you to learn French. I hope you are taking French classes. We are forcing you to learn all kinds of things. Because you must develop an eye for tomorrow. Those who wait for tomorrow to come, wait too late. It is developing the eyes of tomorrow today that enable you to stay affront and beyond your competitors and your colleagues. And therefore, let me call Dr. Agbaje, who is here representing the Dean of the Faculty of Health. Please come up, sir. And I hope you know him. If you don't know him, he's a great writer. Oh, he's a great poet. Every day, I don't know how he does it. Every day he writes a message. You ask a Kotebusu, and he explains it. I hope you have access to it. I just published a book. I'm glad you gave me. Thank you for giving me a copy of the book, sir. And let me, on behalf of the management, hereby formally commission this body, and let me call the coordinator. And I want to thank Esther Oluwayinka for having continuously encouraged our heart that this is a path to go. If Ms. Cholanke didn't encourage us, we probably would not have started this journey. So this journey does not start with us in management. I like to be honest with people. This journey started with her pushing. And that's what happens when you believe in your own dream and you push it, it simply becomes larger, and other people buy into it. So I want to thank her for pushing this dream. And on this occasion, I was thinking, what should I do? Should I take her hand and join to his hand? Someone will say, somebody will capture it on and go and send it on WhatsApp now and say, the VC is marrying somebody to somebody's house. But on a more formal note, let me formally ask that you take over this coordination and this platform. That does not exclude any other person. It's simply that you give it an institutional platform where the coordinator and others will continue to work with you. And I do hope that the students group will also continue to select leaders that will work with you. This belongs to you. It is not about management. All that we're doing is to just ensure that we give you some competitive advantage over those to be meeting as you go into your own world. So I want to congratulate you again for being here. I want to thank her, and I want to hand over to him, and perhaps we'll say a few words. Thank you, sir.
Mr. Vice Chancellor, some existing protocols, thank you very much for the opportunity to formalize the handing over of the debating society to our faculty. As students, I want to thank all of you for your interest in this exercise. As I've told you earlier on, this is a platform for you to be great in life, to acquire skills, to take you beyond your imagination. It's a platform for you to demonstrate, to acquire skills for persuasive speech, skills that enable you to present your points, your views, your perspectives in a convincing manner, and enable you to have empathy, to understand oppositions and how to handle them, and broaden your mind. It will take you to places, regardless of your particular disciplines, because speech is primacy in development. And I promise you, we shall make ourselves available for your service. Anytime you need us, please contact us. We shall discuss with our partners and get across your leaders how we can work effectively and sustain this spirit. Your presentation was fantastic. I was impressed to see your display of intellectual rigors this afternoon. You're able to share your points convincingly. You're able to demonstrate empathy. You're able to learn from one another and to give balanced views. Kudos to you. Please clap for yourselves. I see greatness in you and shall materialize. God bless you.
So, without wasting time, we'll move to the final competition in this tournament. Put your hands together as you welcome with me the quiz master, Olanrewaju Omotayo.
Good afternoon, everyone. Good afternoon, everyone. Good afternoon, Vice Chancellor. Good afternoon, Deputy Vice Chancellor and other dignitaries. Okay, so we're starting the quiz now, and I want to invite the adjudicators to come forward. Please, let's be very fast. All right, so before we start, there are rules to the quiz sessions. I want to invite all the quizzers from all the faculties that qualified for finals to come forward. Our faculty of nursing science, faculty of medical rehabilitation, faculty of clinical sciences, and faculty of basic medical sciences. Thank you very much. All right, so the rules of the quiz. All right, so the quiz is divided into 3 sessions: Blitz,
This way.
general knowledge, and general science. Then for the Blitz, there are 15 questions that will be answered in 100 seconds. And each of the Blitz questions carries 3 marks. For the general knowledge, there are 3 questions per faculty, and each question carries 5 marks. For general sciences, it's divided into biology, chemistry, physics, and mathematics. And each faculty has only an opportunity to answer just 1 from these 4 areas. The use of calculator is discouraged. If you are found using a calculator, you will be sent out of the tournament. There will be bonus, but there will be bonus. There won't be bonus for quiz, but there will be bonus in general sciences and general knowledge. And it is only for questions where you have to provide the answers, not MCQs, not options. Then finally, you only have 10 seconds to answer questions on general knowledge and general sciences, and 15 seconds to answer specifically mathematics. All right, are we good to go? All right, so those is clinical sciences. Can you raise up your hand? All right, basic medical sciences, nursing sciences, and medical rehabilitation. All right, thank you very much. So we'll be starting now, and can you hear me?
We're one.
All right, do you get Faculty of Medical Rehab first? Who is number 2? Who is number 2 in the arrangement? Nursing. Who is number 2? Not sport, the arrangement. Nursing. Who is number 2? You guys are number 2. All right, so can we start? All right, timekeeper, are you ready? All right, pot 5. I wish you good luck. All right.
Next. Okonjo-Iweala.
Correct.
Next. O negative.
Correct.
Next. Next. Next.
Correct.
Next. Next. Chinua Achebe.
Correct.
Next. 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 Burkina Faso.
Correct.
Next. Next.
Correct.
Next.
Correct.
Please go back. What the hell?
Very. Wrong.
Next. Wait, Antonio Guterres.
What do you call it?
No worry. Next.
Next.
I'm
Obasanjo. Wrong.
Next. Animalia.
Wrong.
Plante.
Wrong. Correct. Time up. Thank you very much. All right. Who's next faculty? Can you be fast, please? What pot? Please, 3 marks for each question, please. Pot what?
4.
Pot 4. All right. Pot 4. 100 seconds. All right. So. All right. So pot 4. I'm sorry. Sorry, it was named pot 3, but it's pot 4. Sorry for that. All right. All right. Can we start?
3 root 5 over 5.
What?
3 root 5 over 5.
Correct.
Pineal gland.
Correct.
Adamawa.
Wrong.
Adamawa State.
Wrong.
Skip. Taraba State. Plateau.
Wrong.
Nkosia, Chimamanda.
Full name.
Adichie.
Correct.
14.
Wrong.
Skip. 42 years. All Nigerians have one number. Wole Soyinka. Skip. Fela.
Full name.
Full name.
Fela Kuti.
Skip. You know this.
Yes.
Keep thinking. Skip. Uganda.
Correct.
That's from number. That's one. 1 over 2.
Wrong.
Oh, skip. 1992.
Wrong.
1994.
Wrong.
1993.
Wrong.
Skip.
Correct.
9.69 seconds.
Wrong.
9.61.
Wrong.
9.59 seconds.
Wrong.
Skip.
Correct.
B3. B3.
Correct.
1963.
Wrong.
Start from scratch. What did we have? It's good. It's in this. Okay. Adamawa.
Wrong.
Taraba.
Correct.
I said Taraba. You already got this.
42 years.
Wrong.
41 years.
Wrong.
24 years.
Wrong.
Skip.
43.
Wrong.
Wole Soyinka. 1973.
All right. Okay.
I pray it's not calculation.
So for part one, so Faculty of Nursing Sciences. Can we start? Can we start? Are you good to go?
Yes.
All right. Good luck.
Sleep paralysis.
Wrong. 2.
Sublimation.
Correct.
Skip. Oh, sorry. What is the probability of bringing a number twice? Skip.
Correct.
Skip. 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 Shei. Skip. I don't know that guy. Librarian.
Correct.
TU. Skip.
You are there, okay.
Skip. John.
You are wrong.
Skip. Electronic point of sale.
Correct.
Tin.
Wrong.
Titanium. Skip. I had this question before. Skip. The US civil rights leader. I have a dream. George Washington.
You are wrong.
Roosevelt.
You are wrong.
Skip.
Correct, Martin Luther. Wrong.
Skip.
All right, thank you very much. All right. What pot? What pot? Pot 3.
Welfare officers for each faculty should come out, please. Welfare officers for each faculty, please come out now.
All right, can we start?
Yes.
Pot 3. I wish you good luck. Okay. Hello. All right, start.
Olympic.
Correct. Please speak louder, please.
Olympic. Skip. Skip. Skip.
21.
Wrong.
23.
Wrong.
Skip.
Wrong.
Flotation.
Wrong.
Skip. Skip.
Please talk louder, please. Eh? Wrong.
Skip. 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 No movement. Skip. Skip. Mandela.
Correct.
Wednesday.
Wrong. Correct.
Skip, please. From beginning. Next, start again. What's that? Skip. Next. Next.
0.1.
No. Check the question.
I can't skip a row. Next. Next.
Correct. 4. Correct. Thank you very much. All right. So let's go to the next round. That is general science. All right, so which faculty comes first? Faculty of Nursing. So for the general sciences, we start with biology. There are 10 questions, 10 in chemistry, 10 in maths, 10 in physics. All right, so just stand up. You don't have to come forward. All right, first, okay? Faculty of Medical Rehab is coming first.
Question 6.
Question 6. So you have 10 seconds.
Vacuum membrane.
Wrong.
Vacuolar membrane.
Wrong. Bonus to you.
Tonoplast.
Correct. All right, your question?
Number 7. 3. Sorry. Okay.
7.
I'll take 7.
10 seconds, please.
Divichissimo.
Wrong. Time up. Bonus to you.
The iris.
Correct. Please, 2 marks for bonus, please. Your question?
Question 3.
Question 3. So don't start yet. Genetic engineering is a fast-growing field in molecular biology. CRISPR is one of the tools used in this engineering. What's the full meaning of CRISPR? So you can start.
No idea.
No idea. No idea. All right, your question.
8.
Question 8. The nerve that controls the movement of the tongue is called what?
Vagus nerve.
No. Bonus to you. Correct. All right, chemistry, you can start. Your question.
Question 3.
3, okay. What is the molecular geometry of ammonia?
sp3.
Molecular geometry, not the... Bonus to you.
Trigonal planar.
Trigonal.
Planar.
Trigonal what?
Planar.
Planar. Yeah. Correct. Please speak louder, please. I can't hear you. All right, your question.
6.
7.
6.
6. What is the formula of calcium carbide?
CaC2.
CH2.
C2. CaC2.
Correct. Please be fast.
Question 5.
Question 5. So let me read the question first. Which of the following substance would you see as an indicator in the titration of sodium bicarbonate against HCl? Then you have the options.
Phenolphthalein.
Wrong. All right, your question. There's no bonus for option, please. All right. 1. All right. A particle contains 9 protons, 10 neutrons, 10 electrons. Is a dash.
Positive ion.
Final answer?
Yes.
Wrong. All right. So now for the mathematics, 15 seconds, please. All right. So you have to be very fast. Faculty of Medical Rehab, your question.
Question 7.
Question 7.
7.
7. All right. Good luck.
$20.
What
centimeter?
Correct.
Question 1.
Question 1. Find the ninth time of the following series: 5, 10, 20, 40, then dash.
8 times 5. 45.
Wrong.
50.
Wrong. Ninth term. You are wrong.
Go on.
Sorry. Your question. Your answer. Your answer. Sorry. Your question.
That's 80.
Your question. You are wrong.
Number 3.
So for number 3, you have just 15 seconds.
So AB minus B over A over minus A.
Over A.
Minus A. AB minus A.
Oh, you are close, but you are wrong.
B over A.
All right. Basic medical sciences. You only have 5 seconds for that. Sorry, you couldn't make it. All right, your question. Your question.
8.
8. All right. Of the following fractions, which is less than 2 over 3?
Seven over 8.
Calculate now. You are wrong. No bonus. Please try and write down some. This is maths. Medical rehab. Your question.
Question 9.
Please don't just give us.
Question 9.
Question 9. All right. $50 degrees. Correct. All right, so are we seeing maths? Yes. Are we seeing maths? Yes. Oh, wait. We've done maths. We are done with maths, so we have to cancel that. So sorry. Sorry, that was the second question. I only have one chance. Sorry. Yes. There's only one round for mathematics. This was our second round, so it's fair. Adjudicators, please. So your biology question, but that was a nice attempt. Brilliant. Physics. Physics, 10 seconds.
Question 4.
Question 4. Good luck.
Elastic.
Correct.
1.
Question 1.
Voltameter.
Correct.
Question 7.
Question 7.
Yes,
7. Are you sure? So what force acts perpendicular to the direction of motion in circular motion?
Centrifugal force.
One more chance. Time up. Your bonus.
Question.
Try.
Centripetal force.
Centripetal force. Correct. Please, you guys you're not stimulating. Your question. Hello.
9.
Question 9. Please. What property of matter determines the resistance of an object to acceleration? Wrong. Sorry. All right, so let's go to the final round, which is general knowledge. All right, so I wish you good luck here. So for general knowledge, each faculty will answer 3 questions. And we have just 15 questions. And please, quizzers, the questions, write down something now. You cannot just pick an answer, please. All right, medical rehab.
Question 12.
Question
12.
4.
12. 1 and 2. 12.
Oh. All right, 12. If psychological response where a victim of abuse or captivity bonds with the abuser or captor is called what?
Stockholm syndrome.
Correct. That is very brilliant. Question 4. Question 4. All right, so question 4. Are you ready? Are you sure? All right, so don't start yet. Arrange in decreasing order the football player.
Ronaldo first, Messi second, Lewandowski third, Salah fourth.
Wrong. Increasing order, wrong.
Salah first, Lewandowski. No, it's not an option. It's an
yes,
order.
You have one chance left.
Salah first, Lewandowski, Messi, then Ronaldo.
Correct. Please, audience, don't make them feel like they know it. Yes. Yes, please.
7.
You should have gotten that wrong if you had kept quiet.
Question 7.
All right, nothing.
7.
All right. What is the slogan or motto of Edo State?
The heartbeat of Nigeria.
Wrong.
Heartbeat of the nation.
Correct.
9.
Question 9. The picture shown is the tallest skyscraper in the world. What is the name of the skyscraper? What do you call it?
Burj Khalifa.
Correct. Burj Khalifa. All right, now you are thinking, okay? Your question.
Question 3.
Question 3. All right. The 2024 Nobel Prize winner in literature is, the 2024 is a recent award. So, I mean, if you are current, this is a bonus. The 2024 Nobel Prize winner in literature is, time up, bonus to clinical sciences. Time up. All right, your question.
1.
Question 1. Wow, this is a very beautiful question. Less than 48 hours ago, ECOWAS approved the withdrawal of 3 countries from the bloc from January 29, 2025. The country will officially cease to be members of ECOWAS from 29th of January 2025. There are just 3 countries. Name these 3 countries.
Burkina Faso.
1.
Mali.
2.
I don't know. I'm not sure. Niger.
Correct.
Allied Health Faculty. Allied Health. Allied Health Welfare Person. Welfare Officer for Allied Health and Faculty of Sciences. We are waiting for you. If your welfare officer is not around, please, someone should come and represent the faculty.
All right. Sorry, please. This happened less than 48 hours ago. So I feel it's recent. All right. Your question.
15.
15. The NYSC, National Youth Service Corps, was instituted by the government of which Nigeria leader?
Obasanjo. General Olusegun Obasanjo.
You are wrong.
You don't try.
Your bonus. Try. Eh?
Nnamdi Azikiwe.
Azikiwe. You are wrong. BMS. 6. All right. Very simple question. In the just concluded VC's tournament, which faculty is the defending champion in table tennis?
Faculty of Science.
Wrong.
Faculty of...
Correct. 2 marks. All right, your question. Is that the final question? Final question. Wow, please do well in the final. All right, your question.
Question 13.
13. Are you sure? All right. Who won the 200-meter race in 20? These are recent events in 2024 Olympics.
It's from Botswana.
Botswana.
The name of the person, not the country.
Tshego something.
Oh, you're wrong. But you got the country right, but you're wrong. All right, your question.
Question 5.
Question 5. Are you sure? Choose the odd one. Microbiologist, this radiographer, that, histologist, that, cardiologist, pharmacologist.
It's not. B?
Wrong. No bonus. All right, your question.
Question 11.
11. All right, this is also a recent event. Dele Farotimi, a Nigerian lawyer, authored a book that led to his arrest recently. What is the title of the book?
The Black Book.
Eh?
The Black Book.
The what?
Black Book.
You are wrong. Your question.
14.
14. Russia-Ukraine war started in what year?
2020.
I can't hear you, please. Speak loud.
2020.
Wrong. One more option.
2021.
Wrong. Bonus to you. Wrong. All right, so, yes, just check it. All right. Thank you very much. We have come to the end of the quiz session.
allied health. If you are, even if you are not their medical person, please come and collect for your people. Can we have allied health representative, please? Result announcements.
Wow. Let's first appreciate the quiz master. He did a very great job. He did a very great job. The action, what else can I say? Appreciate him one more time. That was a great job done. And now we appreciate the various faculties that equally made it to the final. It's not easy. For you to be here today shows how brilliant you have. And they have once again demonstrated brilliance all through.